Hello everyone. Today we'll be discussing managing and controlling pain. Now, if we have a look at our syllabus requires us to know three different ways through which we could manage and control pain. To name them, we have the biological treatments, we have the psychological treatments. Along with that, we have alternative treatments. Now, before we proceed, I'd want us to quickly have a look at the syllabus, a screenshot from the syllabus. And as you all must be aware, every unit, I'm using the word unit over here to refer to a chapter. This particular topic that we would bring in under discussion today is from the unit pain. Each unit is divided into three different sections. This is section 1, this is section 2, and this is section 3. So this topic that we are to discuss today is this managing and controlling pain, right? Now, having a look at this, if you have a closer look, you'd see that this is divided into three different bullets. To name them, we have biological treatment, we have psychological treatment, and we have alternative treatment. Along with that, there are certain relevant issues and debates and methodology for this particular topic, and they include these, right? Remember, you're not restricted to them. These may include number one, application of psychology, or rather say application to everyday life. Number two, cultural differences. Number three, reductionism. Number four, determinism. Number five, ideographic versus nomothetic approach. And number six, objective and subjective data. Now, taking this step ahead, let's have a look at biological treatments first. When we speak about biological treatments, there are, I mean, it's pretty relatable. As soon as we experience any sort of pain, be it a headache or a stomach ache, we typically look for medicines. And when I use the word medicine, I'm referring to the biological treatment for pain, right? I'm referring to the biological treatment for pain. Now, there are various biological treatments for pain, with one type being analgesics. This is one particular biological treatment out of many others, and we refer to this as analgesics, right? Analgesics are typically or commonly referred to as painkillers. They come in different forms, they come with different strengths as well, not to ignore. Now, taking this ahead, analgesics again could be further subcategorized into two different groups, and we would refer to them as non-steroidal anti-inflammatory drugs, also referred to as NSAIDs, and opioids, right? Now, I am trying to walk you through the syllabus. I'm trying to help you cover the syllabus in, I mean, I don't want to drag this. I want us to know enough for now to be able to score a decent grade in our CIs. So when we speak about NSAIDs and opioids, right? Now, why is it that we use NSAIDs, or why is it that we use opioids? To talk about them a bit further, let's talk about NSAIDs first. NSAIDs work by reducing the production of prostaglandins, reducing the production of prostaglandins. This is a hormone-like substance. What are prostaglandins? They're hormone-like substances that cause pain. So you reduce them, right? They're available over the counter, another characteristic, or in stronger form by prescription as well, but they can have side effects. Now, when you talk about biological treatments, any sort of medicine, we all know that they are quicker if you compare them with the psychological treatments. They are more convenient. It could be something as simple as popping a pill. However, at the same time, we shouldn't ignore the fact that they almost all contain side effects. So the side effects could contain indigestion, headaches, or even drowsiness. Taking this ahead, if we move on and talk about opioids over here, opioids, on the other hand, work by binding to opioid receptor in the brain, which then releases signals that reduce pain perception and increases feelings of pleasure. I like to break this into three parts so that you understand it easier. Number one, we spoke about how opioids bind to opioid receptors in the brain. One. Number two, which then releases signals that reduce pain perception. Number three, at the same time, they increase feelings of pleasure as well, which I'm sure you've heard. Many people, they get stuck up with opioids. Many people get addicted to opioids, which again is wrong. Opioids are often used for acute pain. Now, at the beginning of this unit, we had spoken about the difference between chronic pain, acute pain, and and psychogenic pain as well, where we had studied about phantom limb pain. So opioids are often used for acute pain and are very effective, but they carry a risk of side effects such as drowsiness again, slowed heart rate, and potential addiction due to the mood boost they provide. So this is what we're talking about. Now, remember, if I may remind you, in paper three, we get a 6 mark question where we are expected to describe a particular bullet. As I had shown you, this is a bullet that I'm referring to, right? So this is a particular bullet that I'm referring to. If you're getting this particular 6 mark, if you're getting a question where you are asked to describe this, uh, this would be worth 6 marks. And the next question where you'd be asked to evaluate this, this would be worth 10 marks. I'd like to talk about this when I'm done covering these three bullets, right? So you could possibly get a 6 mark question on this where you're expected to write this and this. Moving on, if we move on towards psychological treatments, as we talk about psychological treatments and we compare them with biological treatments, psychological treatments, they do not have any side effects. One. Number two, they can be learned relatively easily. We're talking about psychological treatments or psychological therapies. Number three, they can be practiced and used without any professional help as well. So you don't really need to be dependent on anyone. So, uh, we just spoke about a comparison between psychological treatments and biological treatments. However, if we have a look at a syllabus, we are expected to know these three different types of psychological treatments. To name them, we'd initially speak about attention diversion. Number two, we'd speak about non-pain imagery. Number three, we'd speak about cognitive redefinition. Now, what exactly is attention diversion? As the name suggests, when you are diverting your attention from pain, when you're diverting your attention from pain, a lot of what we study under health psychology is relatable. It's pretty relatable. You know, something if we've gotten ourselves hurt, and if we're experiencing pain, if we try to divert our mind, if we try to divert our attention to something that is not related to that particular injury that we've had, we might be able to experience lesser amount of pain, right? So one way to cope with pain is through attention diversion. Now, another important thing that I'd want you all to keep in mind, because I've seen many students getting confused between attention diversion and non-pain imagery. I'm talking about these two. Now, when we speak about attention diversion typically has to do with you diverting yourself with something that is available in the immediate environment, right? Could be a painting nearby, could be a stress ball in your hand, could be anything that helps you stay distracted from the immediate environment. However, on the other hand, when we speak about non-pain imagery has more to do with you imagining something that is totally out of context with what you're going through at that particular time, and as well as the environment too. For instance, you hurt yourself, and you but to be able to experience lesser amount of pain, you start imagining uh, the next vacation you've planned, right? So taking this ahead, we would initially speak about attention diversion, and then we'd move on towards non-pain imagery. So attention diversion, one way to cope with pain is through attention diversion, which is a cognitive strategy, right? Now, this involves shifting your focus away from the pain and onto something else, right? When you're shifting your focus from that painful situation to another situation, right? While it doesn't make the pain go away, it helps reduce the focus on the pain, making it easier to handle. So this would make it easier for you to handle the situation. Why would it make it easier for you to handle the situation? This would make it easier for you to handle the situation by allowing you to shift your focus away from that pain onto something else. Attention diversion works by competing for attention, directing it towards an activity like solving a puzzle, like receiving a massage, using a stress ball, doing crafts, listening to audiobooks or music, counting or practicing deep breath, along with many other different ways that could possibly be used as well. So we were speaking about how we could manage and control pain. Like I had initially said, your syllabus requires you to know three different type of treatments: the biological treatment to begin with, number two, the psychological treatment, and number three, we speak about alternative treatments. And all three of these different treatments, they come under they three different bullets that come under the heading of managing and controlling pain, which is again the third section to the unit pain. Now, taking this ahead, it is important to practice these distraction techniques. Like I had mentioned earlier, if you talk about biological techniques, they're relatively easier, they're relatively more convenient, they're relatively require not much of an effort. However, if we speak about psychological treatments, they are more demanding. I think the word demanding would do justice over here. They're more demanding. They'd expect you to be practicing this distraction technique, as it can be challenging to divert attention during severe pain. Now, I could think of something else while uh, not being in pain, but then again, you need to practice it beforehand so that tomorrow, God forbid, if you experience any pain, if you have any particular injury, it gets easier for you to try to shift your focus away from pain to something else, right? Now, as it can be challenging to divert attention during severe pain, this skill needs to be developed over time. It is demanding. This is time consuming. I just write it down. This is demanding. This is seen to be more time consuming. Not everyone has the uh, mental capacity, not everyone has the motivation to, not everyone is ready to put in that much of effort. So that could again be a drawback. Each person may find different techniques more effective. Individual differences. I just So there are individual differences that are there as well. Individual differences, each person may find different techniques more effective. So there may be some trial and error as well. Attention diversion is typically more effective for managing mild or moderate pain rather than severe pain. I think that came without saying as well, because you cannot expect someone to have an open heart surgery while requesting them to divert their attention. You don't want to kill them. So the first over here was attention diversion. Attention diversion now being followed by non-pain imagery. What is non-pain imagery? This picture pretty much explains what I was trying to explain you. I mean, you could, while pain, you could imagine or you could put yourself mentally through a situation where you're uh, having a vacation. So another way to manage pain is through non-pain imagery. This is again a cognitive strategy. This involves thinking about a peaceful and relaxing situation or scene instead of focusing on the pain. So again, this has to do with your thought process. This has to do with your cognitions. This is when you're thinking of a peaceful and relaxing situation or scene instead of focusing on the pain. By doing this, a person can slow their breathing, because typically when you're experiencing pain, your heartbeat goes up, reducing the heart rate and lower the blood pressure as well. These changes help create a sense of calm and relaxation, which can help manage the pain better. Remember, we if you uh did if you did catch this, when I named the section of this particular named this particular section, it said managing and controlling pain, right? We're talking about managing pain. We're not talking about eliminating pain over here, right? So non-pain imagery can be practiced using an audio recording that guides the individual through the relaxation scene, right? So how is it that you do this? You could probably take a start like this, being guided through the relaxation scene and how to focus on different aspects of it. Now, practice is needed to fully achieve relaxation, as I had mentioned a couple of minutes back. This is again an example of a psychological treatment, which is demanding. Practice is needed to fully achieve relaxation and engage all senses. This might not be very easy for everyone. Let's just say person A might be better at doing this as compared to person B, as compared to person C, so on and so forth. Like attention diversion, non-pain imagery is more effective for mild or moderate pain and less effective for severe pain. Now, we have spoken about attention diversion. We've spoken about non-pain imagery. Number three, we speak about cognitive redefinition, right? Now, have a look at what this word over here says, cognitive redefinition, or you are redefining your thought process, right? You are redefining your cognitions. This is another cognitive strategy for dealing with pain in and which is referred to as cognitive redefinition. This involves replacing negative or threatening thoughts about the pain with more positive or rational ones. At times you feel, at times you're experiencing so much of pain that you feel like you're dying. You feel like this is where the world would come to an end. So this cognitive redefinition has more to do with you trying to replace your thoughts, you trying to redefine your thoughts, you trying to eliminate thoughts that were negative or replace them with something that's more positive, that's something that's more rational, that's something that would help you deal with or help you manage your pain better. So while this doesn't make the pain disappear, of course, it helps manage it better by changing how they think about it. I'm sure you would agree to this. If you're going through a painful situation, the more we think about it, the more painful it becomes. Now, this is something that we had discussed at the earlier part of the unit as well. So while this doesn't make the pain disappear, it helps people manage it better by changing how they think about it. There are two types of self-statements that are typically used. Again, typically, not necessarily. Number one, we'd speak about coping statements. Number two, we'd speak about reinterpretative statements, right? Now, if you have a closer look and see, this pretty much again explains it all. When you are trying to cope up with the pain you're experiencing, number one. Number two, when you're trying to reinterpret the situation. So a coping statement over here, these focus on the person's ability, right? They focus on a person's ability to handle the pain. For example, saying to yourself, I can manage this pain. I can do it, right? Number two, reinterpretative statements. These help change the way pain is perceived, right? Your perception of pain by removing negative association by it. For example, thinking this pain is temporary. A couple of few seconds, a couple of few minutes, and then it would be gone. This is not where the world would end, right? So a coping statement and a reinterpretative statement. Cognitive redefinition is particularly effective for managing severe pain, right? In contrast to the two that we had discussed earlier. Now, let me remind you all before we get off track, we are discussing managing and controlling pain. And there are three different type of pain that we are to bring in under discussion over here. The first one over here was biological, three different type of treatments. Yeah, that's what I said. Or maybe I didn't. So this is about, so there are three different treatments that we'll be taking into account over here. Number one, biological treatments. Number two, psychological treatments. And number three, we'd speak about alternative treatments. Now, as we speak about these alternative treatments to manage or to control pain, number one, we'd speak about acupuncture. Number two, we'd speak about TENS, also referred to as transcutaneous electric nerve stimulation. Transcutaneous electric nerve stimulation, right? So alternative treatments, number one, let's talk about acupuncture. Acupuncture, let me show you this picture again. This is something that you've probably seen in many movies or in documentary or on YouTube. So taking this ahead, acupuncture is an ancient Asian practice which is now gaining popularity in the Western cultures as well. This is used to treat various conditions, including pain too. So acupuncture is not only restricted to managing pain, it is used in various other conditions as well. It involves inserting thin needles at specific points on the skin. Acupuncturists typically use acupuncturists typically use 4 to 10 needles, leaving them in place for 10 to 30 minutes. Several sessions are usually recommended. One doesn't help. Acupuncture is thought to work by releasing endorphins. How? It is thought to, right? You can never be certain. Lack of evidence again. This is thought to be releasing endorphins and increasing serotonin levels in the brain. So increasing serotonin levels in the brain would help you manage your pain better. Now, taking this ahead, the effectiveness of acupuncture in pain is really effectiveness of acupuncture in pain relief is debated. Lack of empirical evidence. Empirical evidence is research-based evidence, and it is unclear if its benefits are due to a placebo effect or actual treatment. So it could possibly be because of the placebo effect as well. When you feel like the pain is going to disappear, when you again, this could be linked to the uh, cognitive therapies or cognitive treatments as well. When you uh, when you feel when you're expecting or anticipating a relief, you might as well experience it too. Nonetheless, it has few side effects, making it a low risk option for pain management. So it doesn't really it doesn't really have side effects. It's an easier and a safer manner. Number two, we'd speak about TENS, also referred to as transcutaneous electric nerve stimulation. What is this? This is a stimulation therapy, right? Another alternative treatment is stimulation therapy, also known as TENS, transcutaneous electric nerve stimulation. TENS involves using a small device with electrodes to deliver a mild electric current to the painful area. This current creates a tingling sensation on the skin. The electrical impulses help reduce pain signals to the brain and spinal cord, which can relieve pain and relax muscles. What does it do? The electrical impulses helps reduce pain signals to the brain and the spinal cord, which can relieve pain and relax your muscles. They may also stimulate the production of endorphins. TENS can be used for various conditions like arthritis, sports injuries, and even during childbirth for pain relief. While there's limited evidence supporting TENS as a consistent pain relief method, it works well for some people and in some conditions, not all too. TENS provides temporary relief while in use, but it's safe and can be a good alternative for pain management. Now, I hope this has been helpful. Let me take you to uh, a few questions. Now, if we have a question like this again happens to be for paper 3. So yeah, in paper 3, you could get a question like this. You typically do get a 6 mark and a 10 mark question for both the components that you've studied. In our case, for you'd have to attempt a 6 and a 10 marker for health psychology and a 6 and a 10 marker for clinical psychology as well. So describe psychological treatments for managing and controlling pain. Here you go. At this point, you need to remind yourself that there were 3 psychological treatments that were part of your syllabus. They were number 1, attention diversion. Number 2, you had a non-pain imagery. Number 3, you had cognitive redefinition, right? So if you're getting a 6-mark question, you might as well be mentally prepared to write worth 2 marks for each. I've always recommended students uh, to remind themselves about the number of marks a particular question holds and the content and the possible content they have. And I think we did cover enough of content to be able to write 2 marks for each for attention diversion, non-pain imagery, or for cognitive redefinition. So yeah. For this 6-mark question, okay, another important thing that has to be kept in mind, there are many students I've seen them write quite a lot. I personally think they write more than they should. So do not over rely on quantity. Instead, try to focus more on the quality of your work. Do not get derailed. And remember, in our CAIE, since we have 90 minutes for a 60-mark paper, a simple calculation, 1.5 minutes per mark. And according to that particular calculation for this particular question, you should not spend anything more than 9 minutes. So again, uh, student A could write more in 9 minutes, student B could write less. So that totally depends on you. You need to make a point that you are using psychological terminologies. You need to make a point that you're sticking to your syllabus. You need to make a point you're not getting derailed. You need to make a point that you are uh, writing enough, providing enough of detail, which is again accurate to be able to get the maximum number of marks. So along with this descriptive question, the next question we get is an evaluative question on the same topic. Now, let me just highlight both of these in green so that you see it's exactly the same, right? Now, what the difference is over here, for 6 marker, they're asking you to describe. For 10 marker, they ask you to evaluate, right? So when they're asking you to evaluate, you need to remind yourself you do not need to describe. The description part, you've done it already. Do not do it again. So while you're evaluating the psychological treatment for managing and controlling pain, you're expected to include a discussion on, could be anything. Typically, it would be something from here. Let me just this, because this says relevant issues. Now, this is something that I've picked up from the syllabus, right? This is a screenshot from the syllabus. So relevant issues and debates and methodology for this topic include, right? Include, like I'd mentioned earlier, could be anything else as well. Application to everyday life, cultural differences, reductionism versus holism, determinism versus free will, ideographic versus nomothetic approaches, and objective and subjective data. So let's just say this particular question, this says ideographic versus nomothetic approach. So the question would probably be like, evaluate psychological treatments for managing and controlling pain, including a discussion on ideographic versus nomothetic approach. Now, in this case, this is your named issue, right? This is your named issue. And what I suggest students to do is to divide their answer into 5 different paragraphs. That's what I typically advise my students to do. The first one should be a decent introduction. The second paragraph should be evaluating through the named issue, because you're evaluating that particular part of the syllabus through the named issue, right? The third paragraph would be evaluating another point, could be from the ones that you had mentioned in your syllabus. For that, you need to know your syllabus. I think you would have a basic idea when you practice. And the last paragraph should have your conclusion. So this is when you are introducing. That could, I mean, you could prepare a template too that would work for many answers. That's an easy way to save yourself some time, because remember, because this is a 10-mark question, you don't get anything more than 15 minutes. Nothing more than 15 minutes, remember. So over here, you evaluate your named issue. And the named issue over here was ideographic versus nomothetic approach. For the ones who do not remember, the simplest of way to remember this, ideography or the ideographic approach focuses more on individuals, on a single individual, right? However, the nomothetic approach is when you're doing something for many or for all, or something that you've come up with that collectively helps individuals. So this would be your named issue being evaluated. Along with that, evaluate that particular part of the syllabus. Evaluation number 2. This could be evaluation number 3, and then a decent conclusion, right? So all of this has to be done in 15 minutes. Many students do not do this. I strongly recommend that you should keep a check on time. Keep a check on time. Let's be realistic. It wouldn't uh, cost you anything. It wouldn't. It's about you being more uh, you going more prepared, right? So all you need to do is one sit and write your answer in one go. Number two, when you start your answer, you you might as well start a stopwatch. That's easy and convenient. Every cellular phone has that option. So let's just say this was the named issue, right? Now, ideographic versus nomothetic approach. Although cognitive redefinition may be effective for some patients, it may not work for others. Imagine a person who has learned that they are resistant to local anesthetic. Next time they have a procedure requiring local anesthetic, they may be fearful that the procedure is going to hurt. In this case, their fears are rational as they are based on past experience, meaning cognitive redefinition may be ineffective. Therefore, an ideographic approach is more appropriate to ensure whether patient's thoughts are actually illogical or rational. So you could, I mean, this is not a model paragraph. This is just to give you a basic idea as to how you could evaluate uh, through a particular point. Now, I'd like to quickly show you another question. Now, for instance, you get another question that says, describe alternative treatments for managing and controlling pain. Remind yourself of what the syllabus looked like. You had uh, acupuncture as well as TENS. So again, the same points you could. Cultural differences. Acupuncture presents an alternative approach to pain management rooted in ancient Chinese practices. This highlights the availability of non-traditional pain relief methods beyond Western medical treatments like drug therapy, which are backed by empirical evidence. Now, remember, uh, according to our current syllabus, we have 5 different units or 5 different chapters, just like we had them earlier. But for every chapter now, or for every unit, like the unit that we're currently discussing over here is pain, for every unit, there's a key study, which I'm sure you'd all be aware of. So for every unit, there's a key study. And yeah, that reminds me, the key study that you have for uh, this particular unit, that is pain, I did record it. Yeah, I did record it. It would be available to just in case if you're interested. So yeah, where was I? So when we talk about the key study, besides the key study, there are other example studies as well that are mentioned or specified in the syllabus, right? So the examiner, according to the principal examiner rather, you could use an alternative study to the example study as well. If you have a look at your course book does not provide any example study for acupuncture. So you might as well use this. Now, a question at this point might be, do we have to do it? No, you don't have to do it. And of course, because it's not specified in the syllabus, no one's going to question you on this research. But of course, you could use it to further support what you're writing and to ensure that you're getting the marks that you'd want to get. So again, cultural differences here. Now, uh, for instance, a study by Hugh et al. Revealed that cancer patients undergoing acupuncture in addition to conventional drug therapy reported a more significant reduction in pain compared to those solely receiving conventional drug treatments. So this could be used along with conventional methods as well. This underscores the benefits of offering patients a diverse array of effective treatment options beyond Western medications. Such diversification is crucial, especially considering that certain individuals may experience severe side effects from medication too. By providing acupuncture as a viable pain management option, individuals can potentially avoid these adverse effects. Again, a disclaimer, this is not a model paragraph, evaluative paragraph. This is just to show you how you could go about writing down your answers. So with this, let me take you back and show you what we actually did today. So this was the unit, this section, this was from the section managing and controlling pain. Managing and controlling pain comes under the heading of the unit or the chapter pain. This is the third section that we covered today, managing and controlling pain. And this is what we discussed. We discussed biochemical treatments where we spoke about NSAIDs and opioids. Number two, we spoke about psychological treatments that included attention diversion, non-pain imagery, and cognitive redefinition. We went on to discuss alternative treatments where we had acupuncture and simulation therapy slash transcutaneous electric nerve stimulation. So yeah, this is pretty much it. I hope this was helpful. And take good care of yourself. Stay happy, healthy, safe, and protected. Stay humble, spread positivity, spread smiles, and Allah Hafiz.